Watching a loved one struggle with a disease or an accident such as autism, muscular dystrophy, brain traumas, or even a stroke can be extremely difficult, especially when it comes to their day to day living, and even simple tasks such as eating, bathing, and getting dressed. Well, that is what an occupational therapist is for. Hi, my name is Taylor Agee, and I'm here to talk to you about the importance and the types of things that occupational therapists can do to help your friends, family, and loved ones live a more comfortable life. Occupational therapists study human growth and development and a person's interaction with the environment when it comes to daily living. When it comes to a child with autism, an occupational therapist will work with parents, teachers, and other healthcare professionals to set specific goals for the child to reach or overcome, which often involves social interaction or in-class performance. Once an occupational therapist has gathered enough information, they can then develop a program for the child that can help them throughout the rest of their life. When it comes to muscular dystrophy, symptoms of the disease usually start before the age of 6. Symptoms can usually include fatigue, impairment, muscle weakness, and progressive difficulty walking. An occupational therapist can aid in assistance to these patients by helping them learn to use utensils, learning to write simple words, learning to use a wheelchair, or maybe even learning to talk and let their parents know what they may need. I do have a friend with muscular dystrophy. I have watched how an occupational therapist has helped him live in today's society and how he has improved daily with such simple tasks as eating and talking. He was only supposed to live to be about 2 years old. He's now 25 and he's doing pretty well. Causes of traumatic brain traumas are varied and often sufficient severity to require occupational therapy. A blow to the head sustained during a traffic accident can have serious long-term implications. An impact which causes a skull fracture resulting from a fall, a football tackle, or a fall off a horse, or a gunshot to the brain will injure the brain with varying degrees of severity, depending on the factors such as the severity location. An extreme injury of the head which causes movement of the brain within the skull can damage the brain tissue and nerves. This type of brain injury, the cause of such conditions such as shaken infant syndrome, can result from physical violence. An occupational therapist can help these patients concentrate upon relearning activities such as basic hand washing or eating. They will progress to daily activities such as bed making, grocery shopping, and cooking meals. Finally, well into the recovery period, the OT may focus on retraining their patient with exercise and memory strengthening activities. A stroke is a leading cause of adult disability in the United States, with an estimated 7 million stroke survivors. Each year, approximately 795,000 people either have a new or reoccurrent stroke. Survivors face multiple challenges, such as weakness on the side of the body, decline in emotional functioning, social disability and inability to walk and care for themselves, and a decrease in social participation. Occupational therapy can be vital when it comes to these challenges at all stages of the continuum of their care. An occupational therapist will make sure that the patient is completely ready to be on their own before leaving them, but will continue to check back to make sure that they are where they need to be in the rehabilitation progress. In conclusion, an occupational therapist is a vital part of rehabilitation, or even for life when it comes to any of those diseases and much more. I believe that an occupational therapist can not only help aid in day-to-day living, but also be there as a friend or even part of the family to these patients, which can be very important as well. It is my passion to become an occupational therapist and be able to work with children and teens with these types of illnesses and disabilities and help them live their life to the fullest potential. I hope this speech has given you a little more insight to the importance of an occupational therapist. You can find more information, such as from human growth and development to occupational therapies with muscular dystrophy, at WebMD/brain/autism, or benefits of an occupational therapist /muscular dystrophy. Also, brainandspinalcord.org/injury/occupational therapy. Thank you.